Hello, my name is Joshua Ozawa-Morriello. I'm a senior nursing student from William Patterson University in northern New Jersey, and I'm here to talk to you today about patient blood management, effectiveness, global implementation, and nursing education. So patient blood management is a relatively new topic or a concept that was created in the last 20 years to approach blood management for patients for whom blood transfusion was not an option. So patient blood management was the outcome of this. So some background and significance. Blood transfusions are a life-saving procedure that help patients around the world, but due to limitations of the blood supply, safe and appropriate use of these blood products is necessary. We're seeing around the world that there's always a call for more blood and blood donation, so this is an important topic to go over. Blood transfusions have become one of the five most overused therapeutic procedures performed in the United States and around the world. This is true statistically speaking. It is one of the most overused procedures in the world, and considering its intensity on the human body, it needs to be reduced. Blood transfusions are evidently both ineffective and injurious. So over time, we've seen in multiple studies that blood transfusions have led to adverse outcomes, multiple side effects, multiple reactions, long-term disease processes like HIV or hepatitis. And so we're seeing that these blood transfusions are evidently ineffective and injurious. It is clear that an alternative to blood transfusions is necessary in an inpatient setting to benefit patient outcomes. And the solution to this is patient blood management, which is a series of things that focus around the management of anemia and management of blood perioperatively, especially in operative patients. So this includes the optimization of hematopoiesis and minimization of blood loss during surgery, the proper treatment of anemia, and the optimization of anemia tolerance. So this study was completed as a threefold study, including one systematic review and two qualitative studies. We'll go through each of them individually. So the first one is, what is patient blood management, and how effective is it as an evidence-based practice? So what I specifically did was a literature review and a systematic review of the literature, looking at multiple studies that use patient blood management in surgical settings. So my methodology, we had an article selection which was outcome-based, with only peer-reviewed articles, and had to be within the last 20 years. So it was primarily through the CINAHL database. The search terms were patient blood management, surgery, blood transfusions and surgery, reducing blood transfusions and surgery. Terms like this to really aim down patient blood management during surgery. Overall, I collected 35 articles and excluded any reviews or reflections, which left me with a total of 29 articles. So the results, we see that multiple studies have shown that patient blood management improved outcomes in all patients in all surgical fields: cardiothoracic surgery, orthopedic, oncologic, severely anemic patients. All of these surgical and medical dimensions were covered by patient blood management and showed better outcomes for all of these patients. So these studies have shown the effectiveness of these successful programs. Patient blood management is the standard of care for all patients, regardless of religious backgrounds. We're trying to shift the paradigm from one of blood transfusion, where blood transfusion is the standard of care, to one where patient blood management is the standard of care. We do not want to transfuse blood right away due to the effects on the human body that can have. There are other ways to treat blood transfusion, like iron management or anemia management or blood loss management during surgery. All of these are concepts of patient blood management that can replace or come before blood transfusion becomes an option. But there are some barriers to this implementation. There's a lack of knowledge around PBM. Since it's a relatively new topic within the last 20 years, many physicians do not see patient blood management as the standard of care just yet, due to the fact that blood transfusions have been the standard of care for so long. They're taught how blood transfusions, they're taught in a hemoglobin number where to transfuse blood, which is not necessarily the best choice, especially with PBM and these concepts. There's a need to refocus on PBM as the standard practice in all hospitals. So the best thing to do is surround the hospitals and all of these programs with patient blood management, as opposed to blood transfusion, making blood transfusion a later option in cases where it is necessary, like hypovolemic shock or some other major issue. There's also a need for focus on patient blood management on medical and nursing school students. There's currently no education for patient blood management in nursing schools at all. So this study was also, part of the study was also aimed to look at education and domestically. So the second study that was completed was how is patient blood management being globally implemented? So the methodology here was a qualitative, non-experimental observational study. And the sample was the Society for the Advancement of Patient Blood Management's network of registered programs around the world. So the Society for the Advancement of Patient Blood Management, or also known as SABM, is a organization created to use PBM and implement PBM in domestic hospitals and hospitals around the world, and encourage multiple countries around the world to create their own patient blood management programs. For legal ethical considerations, there's minimal risk. I was not interviewing any specific person for this data collection, so there was no risk to anybody's confidentiality. The data collection was the evaluation of current programs and quantifying them based on what type of implementation they have. So there was either no current implementation, foundational implementation, private practice implementation, recommended implementation where there was recommended standards, and there was mandated implementation where patient blood management was mandated in all hospitals in the country. So the data analysis, it consisted of a list of all of the countries in the world. And then we were looking at which countries have successfully implemented patient blood management programs. And the guidelines for this were that each country with a specific patient blood management program had to follow the SABM standard guidelines. These guidelines included what we talked about above, the optimization of hematopoiesis, the minimization of blood loss and surgery, proper treatment of anemia, optimization of anemia tolerance, and patient-centered decision-making was also one of these branches that is extremely important in SABM and patient blood management standards of care. So the 5 categories, which I already spoke about, were no current implementation, foundational, private practice, recommended, and mandated. So with the study completed, I found that 147 countries currently had no sort of implementation. 12 countries had foundational implementation. 31 countries had recommended implementation, 6 countries had mandated implementation, and only 1 country, which was the United States, actually, that had private practice implementation through SABM. So discussion on this. Global implementation is about 25% present around the world. A lot of these countries, bigger countries, also have mandated or recommended patient blood management for the use in their hospitals. Countries like China, the United Kingdom, Ireland, Italy, some of these big countries. Patient blood management has to be the new standard of care for this new standard of patient care around the world because it improves outcomes for patients, regardless of their religious background, regardless if they were initially treated with a blood transfusion. Blood transfusions, as we talked about, were both evidently ineffective and injurious. So patient blood management provides different outcomes that are much more beneficial to patients in terms of outcome. It reduces their length of stay. It reduces their adverse events after a surgery or after care compared to a blood transfusion. There's a lot of benefits to patient blood management. There's a need for change in common clinical practice. It's currently surrounded with the use of blood transfusion as the common standard of care for anemic patients. But with patient blood management, what we've seen in the systematic review, as we talked about, was effectiveness in managing anemia and managing hemoglobin levels, indicators of anemia with patient blood management, which led to better outcomes for all of these patients. But what is the necessity for teaching these patient blood management concepts in nursing schools or medical schools? There's currently no education in nursing schools or medical schools, which is fairly important considering it's an evidence-based practice, a novel evidence-based practice that has shown to be effective within the past 20 years. So the last portion of the study was what is the extent to which the principles of patient blood management are included and taught in current domestic nursing school curriculums? Do current domestic nursing school program leaders have an interest in including patient blood management concepts in future curricula? So our methodology here was a qualitative, nominal, non-experimental observational study where we looked at all nursing schools around the country and the presence of patient blood management topics and their interest in including these topics in future curricula. So we looked at the sample was a stratified sample of of nursing schools around the country. So I selected one. There's 2 types of accreditation for nursing schools, which are CCNE and ACEN accreditation. So I chose 2, one for CCNE, one ACEN school for each state, which led to a whole stratified sample of 104 nursing schools from the 50 states plus Washington, D.C. and Puerto Rico. The legal ethical concerns, there was minimal risk. I did not ask for any identifying information within the survey. Data collection was completed through SurveyMonkey, and this study was approved for expedited IRB approval from William Patterson University. So data analysis was completed through descriptive statistics, specifically looking at percentages of schools who had specific concepts from patient blood management already that were not united under the term patient blood management, but are still being taught. We're looking at, do program leaders know what patient blood management is? What patient blood management concepts are currently present in the curriculum? And is there an interest from program leaders in the incorporation of more concepts of patient blood management and uniting these concepts under the term patient blood management completely? So this study was the most interesting to me. So we found out that most nursing school leaders did not know what patient blood management is. Out of the 104 nursing schools completely surveyed, we had 23 respondents, which is about a 25% completion rate, which is good for this type of survey. So we found that most schools did not know what patient blood management is. In fact, 73.9% of schools did not know what patient blood management is. However, many of these schools actually did teach patient blood management programs in the curriculum. So most of them taught 78.2% of schools taught issues related to prevalence and management of anemia. 95.65% of schools that responded teach bleeding and coagulation issues in their school and management of that. 68.18% of schools teach blood conservation techniques perioperatively. This includes things like cell saver or autologous normal volemic hemodilution in surgery, things to maintain the hemoglobin and hematocrit levels during surgery without the use of blood transfusion. And the last was patient-centered decision-making, which is present in all schools. So for each of these, we see that patient blood management concepts are already being taught in many nursing schools. There's just a need to unite all of these concepts under one front, which is patient blood management, which is what we can do. So the last question on the survey was to see what was the interest of these program leaders in including more concepts on what I just spoke about in the previous data collection and their interest in uniting them under patient blood management totally. So we can see that most of them, from the graph down at the bottom, that most of them were interested in including more concepts from the above topics that we talked about and incorporating them under patient blood management as a whole. So what does that mean for nursing schools? All concepts we saw were already currently present in nursing school curricula. These concepts must be united under patient blood management as a concept in education. So what the future goal for future research and future action is for SABM, the Society for the Advancement of Patient Blood Management, to begin creating curricula and education material for these schools to include patient blood management as an actual topic that is taught in schools. So overall, this last portion of the study was a big indicator for both SABM and personally myself in looking at nursing school perspectives on patient blood management and how to help include some of these standards and these concepts in future education, because we know that this is an evidence-based practice. The overall goal here for this entire study was, remember, looking at patient outcomes. What is the best way that we can improve patient outcomes without the use of blood transfusion? And we can see that patient blood management is definitely a great concept that we can use. And a great practice that we can use that is completely evidence-based and useful in the clinical setting. We can find out more information about patient blood management and their program specifically by looking that up. And then sabm.org has a ton of great resources on patient blood management as well. Last thing to look at are my references down at the bottom here. And we're all good to go. Thank you for listening. If you have any questions, you can feel free to email me, which will have some information on the program. Thank you so much.